May dagdag na paraan laban sa COVID-19. Together, we can be the Solusyon Plus. Bida Plus sa maayos na daloy ng hangin. Bida Plus sa maikling pisikal na interaksyon. Bida Plus sa pagsuporta sa bakuna. Bida Plus sa mga kwento ng kaligtasan sa Bida Barangay. Sa dagdag na pag-iingat, maraming buhay ang maliligtas. Bida Solusyon Plus laban sa COVID-19.
Good morning and Happy New Year, everyone! And for our first unboxing for this year, I think it's good to open this box from Organique in partnership with DOH for this healthcare package. Yan, para for a healthy 2021. What's this Immunostrong package? Daily Essentials from Organique PH. Thank you very much, Organique Acai. This is their core product, the acai berry, from Brazil and manufactured in the US. Second core product is their capsule, acai berry capsule in capsule form, and their newest products, the acai coffee mix, choco mix, and Mestiza is another brand under the Organic family. And this care package includes
It's the most beautiful time of the year. Lights fill the streets, spreading so much cheer. I should be playing in the winter snow, but I'ma be under the mistletoe.
Thank you, Organic California, for sending this over. So if you want to boost your wellness and immunity, give it a try. Follow them. Thank you.
Organic acai has very high levels of antioxidants and essential nutrients that help keep your immune system strong. Organic acai premium blend and freeze-dried capsules daily to help increase your resistance against harmful viruses. Keep yourself and your family healthy and protected with Organique.
Mahalagang paalala, ang Organic Acai Premium Blended Freeze-Dried Capsule ay hindi gamot at hindi dapat gamitin panggamot sa anumang uri ng sakit. Of all the tough decisions you have to make today, your family's health doesn't have to be one of them. Not when you have the choice to go organic and live full, natural, and holistic lives. So start your day right. Load up on antioxidants. Choose only organic superfoods. And keep the momentum going. We're making it easy for you. Live organic, choose organic. It's easier than you think. Mahalagang paalala, ang Organic Acai Premium Blended Freeze-Dried Capsule ay hindi gamot at hindi dapat gamitin panggamot sa anumang uri ng sakit.
Previously on Wellness Wednesday.
Napapurfuse sa blood kung kulang po yung napapasok. Yes, tama, no? Kasi yung 200 over.
That's a lot of people. And in fact, according to the World Health Organization,
Wellness Wednesdays with Organique. We care because you matter.
In support to DOH Vida Solution campaign.
Hi, good afternoon, and welcome to Wellness Wednesday. I'm your host, Luisa Salimbangon, and thank you for joining us today. Now, before we dive into the whole topic today, I just want to get started on our game, which is loading right here. So on our Facebook page, at Organique Inc., we want you to comment on this post and then caption the photo. What you can win in exchange would be 2 Vita bars, 1 almond butter flavor, and 1 cocoa mango flavor, as well as a 100-gram organic cashew trail mix. Now, these Vita bars and trail mixes are actually super good, especially in this time of Lent, because it's Ash Wednesday. It just started. A lot of us are fasting and abstaining from meat today. So if you are looking for light meals on days that you're fasting, or just meat-free alternatives for you to munch on, then I highly recommend trying some of these out. Now, the topic for today, UTI. Now, I know a lot of us are very familiar with UTI. Either we know someone who's had UTI or we've experienced it ourselves. But here's the thing about UTI. It's common, it's annoying, but what do we actually really know about it? So today here we have one of the top UTI experts in the country, because we have here the chairman and assistant professor of the section of urology at the Fatima University Medical Center, Dr. Joseph Lee. Hi, Doc Lee.
Hello, good afternoon, Louisa, and good afternoon to our audience in today's episode of Wellness Wednesday. How are you? Looking good.
Good.
Pretty.
Good. How are you? You look great too, Doc.
It's okay. I've been busy in the hospital for, for the fact that we are still in the pandemic, things are not yet steady, right? Mm-hmm.
Uh-huh. So how has that affected you in urology, this pandemic?
Okay, there are some procedures, Louisa, that we are not allowed because for the fact that we need to have more enclosure. That's one. And the air that is used, especially when we do our laparoscopic and other procedures, the laser procedures, there is a lot of evaporation and all those air exposure. So we do not want to contaminate the patient itself. Not for the fact that all patients are already screened for COVID-19, no, but to make sure that all protocols are safe on the side of the patient and on the side of the doctor. So we still have a bit of strict protocol with regards to some surgical procedure, but we are slowly going into the other procedures that can be done for urological cases.
Oh, okay. I didn't realize, Doc, that there would be such a big effect on urology from a COVID, a respiratory pandemic.
Because most of the time, Louisa, it's because most of the innovation with regards to our surgical procedure uses a lot of vaporization or air, especially in anesthesia, right? So
Yes.
for the fact that the virus is air droplet, air transmitted. Okay, we started with air droplets. Now it's air transmission. So we have to be very careful on that because we have a few incidents of operative COVID coming in. They were negative initially, then afterwards they became positive. So yeah, things have to be very, very strictly monitored on that aspect. Okay.
Right, right. Well, Doc, since this pandemic has hit, have you noticed any changes in UTI? Like, has it increased or decreased?
Glad you asked that question, Luisa, because I think the lockdown has caught much people from going into retention levels. Okay, probably this is stress bound quarantine. We're not used to, right, Luisa, in staying home for that quite a
Yeah.
long period of time. And the initial phase of 2 months last year was really a tremendous effect to, especially to our patients who are the geriatric. When I say geriatric, Luisa, it's the elderly individuals. Okay, so they are the ones that are more stressed, and when you get stressed, you even put stress exerted on the urinary bladder. So this causes more retention, and when you have more retention, then you create a venue to open up for urinary tract infection.
Oh, okay, okay. Okay, thank you, Doc. That's very interesting. And actually, I think that concerns most of us now. No, we're still very stressed under this pandemic. So I
Mhm.
think it's important to talk about, first of all, what is UTI so that we can understand how we can be affected by this kind of stress.
Mhm. Okay. So for starters, when you talk about UTI, sometimes you think, Luisa, it's just a plain and simple infection at hand. Okay. But at the long onset of it, okay, when there is a tremendous colonization of your bacteria or the presence of bacteria in your urine, then they tend to become virulent when the number starts increasing. Okay, so when the number starts increasing, they become virulent because they fight for survival. And the mode for infection, most of the time, when you talk about the urinary tract system, is ascending. Okay, it's not going downward; it's going upward. So um, prevalently, your retention cause accumulation and colonization, and your bacteria become virulent, then they go up. So infection can not only affect the bladder itself, but it can ascend into especially the ureter and the kidney itself. So infection can go even upwards ascendingly.
Ah, okay, okay. So, Doc, ano ba yung types ng UTI? Kasi when you're talking about this infection, parang it has many ways of how it can go, no?
True, true. Thank you for asking that question, Luisa, because there are several types of UTI. We start with the time frame. When you talk about time frame, before we go to our first slide, uh, the time frame is one. You have the acute one. The acute, when you say acute, is 7 days. When you have chronic, that's 2 weeks. Okay. When
Wow.
you have relapsing, is meaning you have an infection and you are not treated adequately, then you have another infection. Okay, with a different organism. When you have recurrent infection, meaning you have again the repeated infection with the same organism. Okay, then you have those that are nosocomial. When you say nosocomial infection, these are hospital bound. That's why,
Right.
Luisa, when you are admitted, we do not want you to stay in the hospital for a lengthy time duration, because you tend to have infection in in you. So you can have nosocomial, meaning hospital acquired infection. Okay. Then we have the catheter induced infection. When you say catheter, there are indwelling instrumentation that you insert into the tract, causing infection for a long period of time. Okay, long period of time because of certain accumulation of infection. Okay, now as we go to the slide that was featured a while ago, These are specific type of infection, okay?
Okay.
So when you say cystitis, cystitis is infection of the bladder. You have to remember, Louisa, sometimes you think of it that the urinary bladder is a thick wall. Even though with a thick wall, they are, what you call that, manipis. Manipis ang
Mm-hmm,
mga
mm-hmm.
balat. So they are easily targeted for bacterial infestation. They are easily targeted for erosion and all those things. So when there is accumulation, when I say, Luisa, accumulation of bacteria, meaning there is colonization, they
Mm-hmm.
multiply. When they multiply and they increase in number, they need to feed. So when there is not ample amount of food to feed, especially within the bladder, you're seeing the slide, they tend to become virulent. That is the point wherein we are in danger of putting ourselves, the body, and the structure that is infected because they will fight for survival. Okay? So cystitis is infection on the lining of the bladder. Okay.
Right. Okay. And then, what about in the kidney? I remember you said it can
Okay.
spread to the
All right.
kidney. No.
Exactly. So, besides your infection in the bladder, as I was
Mm-hmm.
mentioning a while ago, Luisa, infection is ascending, so it goes up. So when the bacteria find its way going up the ureter because there is no food, right? There is already
Mm-hmm.
scarcity when because there is accumulation of the number of bacteria in the bladder. So they have to survive. In order to survive, some of the bacteria will go up because that is where they will find food already. So when they go up, they attack the structures of the blood, the kidney itself. Because in the kidney, you have what? You have nutrients, you have
Mm-hmm.
oxygen, you have everything, right? You know that,
Yes.
Luisa. So there is bountiful food, right? It's like harvesting and harvesting. So when they attack the kidney right now, they cause kidney damage. They cause necrosis, meaning degradation of the renal cells. That's why the slide showed a while ago is termed as pyelonephritis. Okay, so there is pus because there is necrosis, there is destruction of the tubules, and of course there is inflammation because you have nephritis.
All right. Sounds very painful, dog.
When you think of it, Louisa, right? We were talking a while ago of a simple UTI, a
Yes. Yes.
simple
Exactly.
pain. And when this is not taken care of, and we're not concerned about it, and we leave it as is, it will turn out to a more dangerous complication. These are the complication, Louisa, we do not really want, no? Because these are damaging. It is not only damaging, and it causes a lot of financial loss because of the procedures that need to be done, the antimicrobials that need to be given, and worst comes to worst, you get more problems because you might end up having renal failure. When you have renal failure, I hope we don't remove your kidney. I hope we don't do dialysis to you because your kidney will cease to function, right, Luisa? It will cease to
Yeah.
function. That's it.
Right. So, what is this one on this slide, Doc? It looks like it's talking about the whole system now, no? So we went from
All right,
bladder
all
to
right.
kidney, and now we're looking at the whole
Okay.
thing.
Yeah, this slide shows you the other track that it goes. Okay, you have to
Right. Okay.
remember, Luisa. In the middle is the bladder that we were discussing a while ago. The first slide, the cystitis. The one above is the two kidneys, which we talked about, the pyelonephritis. Okay, in between there are tubes, right? These are passageway from the bladder to the kidney. You have your ureter. From the bladder downwards is your urethra. Okay, so is it possible that there is spillage or the bacterial progression can go to your urethra downward descending? Yes, because that is the nearest passage, okay? Actually, these are also entry point of bacteria coming outside. Why? Sometimes patient will tell you, doctor, I feel dysuria, I feel burning sensation, I feel irritation in
Right.
the passages of my genitalia. So those are the signs of the some of the symptoms that most of the patients will inform the physician. Okay, so urethritis is what inflammation or infection of the tract outside, meaning from the male organ or the female organ to the bladder. That is the initial tract that can get also infection. Okay.
Right. Okay, Doc. Well, I think we know that burning is a very common sign of
Mm.
UTI. But then you had mentioned that it's specifically for the when it's in the urethra lung, or that encompasses all of the other forms when it's in the bladder and in the kidneys as well.
Most of the time, you're right, Louisa. You tend to have the symptoms for urethritis or the urethra. Okay. Now, if the
I see. I
infection
see.
tends to go up, then you have other symptomatology. When it goes up, like into the kidneys, then you have lumbar pain, lower back pain. The feeling of feverish. Okay, then sometimes there is severe urinary tract infection. You can even have blood in the urine. When the lining of the urethra or even other organs that were mentioned a while ago becomes so eroded and so irritated, you can have tinge of blood. Okay, you call that hematuria. These are
Right.
severe Louisa type of infection.
So, Doc, say my infection hasn't really gotten very severe yet, no, where I'm really like bleeding and all of that stuff. But what are the typical common signs and symptoms of UTI that we should just be keeping a lookout for?
Okay, very basic. Okay, burning,
Mm-hmm.
itchiness. Okay, when you try to urinate or try to void, it seems that there is dribbling. Not all the urine is coming out. So when in case that you try to micturate or void when you urinate, there is pain. There is pain with the urine coming out. Okay, that's second. Then third, there seems to be pain in the peri-umbilical or the umbilical area. Di ba? It's like when you have dysmenorrhea, Luisa, you have pain in the
Oh,
umbilical area. Okay, so you have pain there because that's very near the bladder because we've talked about the first slide having cystitis. Okay, then what other symptoms we need to look? Fever, of course. When the duration of the infection has gone like more than 24 hours, 48 hours, then probably with the accumulation or the what you call that colonization of the bacteria, you can have fever. Fever is a response to the infection. Okay, then of course you have other pains that encompass that. You have like what we mentioned. If it's going up the kidney already, you have lumbar pains, lower back pains, muscular pains, and everything and those stuff, and blood in the urine.
right. Okay, Doc. So, well, it sounds like my symptoms can be an indicator of where I have my UTI, no, and then what the
Yes,
severity is. But then,
exactly.
yeah, and then so as we had determined in the beginning as well, Doc, UTI is classified according to the timeline,
Mm,
where it's infecting you, and
yes,
what kind of microorganism. Did I get that
right.
correct? Because for example,
Yes, yeah.
yung mga microorganisms and infections you can get from the hospital. So,
Yes, yeah.
Doc, what I noticed here is even though there's a big variety in UTI, there's a lot of commonalities also. So, how about immune causes? Does one type of bacteria cause a different type of timeline, or is it how do I usually get UTI and of all these different types, Doc?
Okay. As we mentioned with regards to the variety of infection, Louisa, okay. Now
Yes.
you try to look at how it will cause you and how is the complication will come later on, okay.
Mm-hmm. Okay.
Nevertheless, there are other organs that we need to look into that it can cause a traumatic effect, okay? And the other causes are the indicators. What are the causes of this infection? Is it poor hygiene? Is it sexually transmitted disease? Is it resistant infection because of overdosing of antimicrobials that persistently because you self-medicate? You do not want to go to the doctor and you try to what? Consult, you know very well, Luisa, Dr. Google. You Google, 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 Google. Okay, you self-medicate and you do not know the consequences of what will happen, okay? Some women can say that contraceptives or putting in instrumentation and other stuff or procedure can cause infection. Yes, and one instrumentation is inserting catheter. That's why we do not want catheter to be in place for the longest, especially for 1 week. The maximum is 2 weeks. Okay, we have to replace it. And other causes of that is very basic physiological. We always tell them, Louisa, I think even in our show here in Wellness Wednesday, not to what? Uh, Retention is bad. If you need to urinate, you need to urinate. Okay? You do not, what do you call that in, to prevent urination, pigilan mo, you cannot do that. Because once you do that, that becomes a bad behavior and that becomes a bad precedent for other complications of UTI. You have to remember, Luisa, a simple UTI can affect other organs that later on can probably affect fertility, the process of your reproduction, or even other organs later on that we will have difficulty in treating. Like for men, you have prostatitis. For females, you have infection of the urethritis, cervicitis. You've heard about this infection of the cervix. And worst comes to worst, you can even have infection of the fallopian tube, right? So
Oh.
this can cause problems of fertility if you want to have children in the future.
Right. Doc, marami ba yung complications, no? For like,
Yeah.
for UTI.
Mm-hmm.
And I don't think most of
Mm-hmm.
us really notice this. Kasi UTI, again, is a very common thing that is just, okay, it's just an infection, it'll pass. But then it can lead to more severe things. So what are some other severe things and risk factors, Doc, that we should be on the
Yeah.
lookout for besides
Uh,
infertility and problems with prostate?
mhm. It's funny, Louisa, that you mentioned about it because, like, I'm a member of the International Infection Society. When we talk
Yeah.
about infection per se, urinary tract infection, that is a whole day session just talking about infection. And when that's a
Yes.
good thing that we are talking it this time on our show because people tend to not really shy away but to forget that this is just a simple infection. Infection lang
Mm-hmm.
yan. But at the end of the day, when their infection started not to gain preceded, meaning they don't get well, then that is the problem. When your infection starts to linger in your body, that is a problem now, okay? The slides that you were showing a while ago gives you a picture of the different complexity of an infection that can
Yes.
be happening or that can cause other organ problems. You can have stones. because of predominance or a lot of your infection. You have kidney stone, bladder stones, whatever. Okay. Now, if your infection is highly what do you call that in numbers, the bacterial counts are numbered, it might impede your urination and give you problems. Okay, then you might not urinate properly. Okay, now with regards to other comorbidity, when you talk about comorbidity or metabolic problems like diabetes, you know, hormonal problems like if you are menopausal or you are in the andropause, that aggravates the infection further, right? Because it is a good bed wherein the bacteria tends to be sufficiently active on the part of your system which is less active. Okay, so what am I talking about? If there is already a drop in the immune system because of bacteremia is bacteria in the blood, or septicemia. You've heard about it, right, Louisa? So there
Yes,
is
yes.
a tremendous bacteria covering your system. Of course, it will bring your immune system down. But if you have no enough defense to do that, then I think all your system will just have to slow down and just shut off, just like that.
Right.
Okay.
Right. Well, Doc, I don't think most of us really want our infections to reach the point of septicemia where you have an infection throughout your whole bloodstream, no? So how do we catch it early? What are the ways that we can diagnose it?
Yeah, good question. A good question. So, basic urinalysis. Even
Mm-hmm.
urinalysis, sometimes, Louisa, they don't want to go for urinalysis. Okay.
Really?
I always tell them you go to a reputable laboratory for urinalysis. Sometimes your urinalysis tends to you tend to question urinalysis because they will go to a laboratory that is like 20 pesos, 30 pesos. I think your results will be questionable. So you go to a reputable laboratory or hospital. Anyway, it's not really expensive. Do urinalysis. Try to see if you have pus cells. Try to see if your pH is okay. Try to see if there is bacteria or whatever. Now, for those patients who have ongoing or recurrent urinary tract infection, Luisa, I always require them to do urine culture and gram stain. This is very important because now at this point we need to know what type of bacteria. Okay, the
Okay.
common bacteria for our audience listening is E. coli. Okay, but sometimes if you have recurrent, relapsing, remember I was telling you about ago, you might encourage other bacteria to come in and join force. Okay,
Oh
you do not
no.
like Klebsiella coming in. You do not like Proteus coming in. And these are bacteria which is prevalent of the lungs. Why is a lung bacteria going into your urinary tract? That is funny, right? So, is there
Yeah.
no space already in the lung area? They want to go down. So that is something that you need to look into. They later on can create stones, kidney stones. So those are the things that why we require urine gram stain and culture and sensitivity for those longer duration of urinary tract infection. And the other thing, for those who have already complication, we just want a simple ultrasound of the kidney, ureter, and bladder. That's it.
Okay. So, Doc, I think some of us know are unfamiliar with what gram stains and the urine culture procedure is like. So, is it scary, Doc? Like, if I think I have reoccurring affection in UTIs, am I gonna get scared trying to go there, or is it very expensive? Like, how do you
No,
encourage people?
no, no. Actually, it's a bit. it's not really pricey, but it's a bit higher in amount compared to urinalysis. The same thing, you give your urine sample, they put the urine in a petri dish. The petri dish is divided into four quadrants. Specifically, they place already the antimicrobial or the drug, okay? Then they spread it out just to see what organism and what organism is sensitive to what type of drug. That is very important, Louisa, because at the end of the day, if there is a certain bacteria or another bacteria that is prevalent in the urinary tract infection, then you can treat it with a adequate and more sensitive type of antimicrobial.
Right. Well, speaking of treatment, Doc, I think it's important for us to move to the next slide, no? So how do you treat it?
Of course, very basic. Okay, if you don't like, if it's a mild type of infection. Most of the physician would just say, drink water. Drink water. Flush it off, flush it. If it's mild, if it's mild, okay. So it's always adequate to say that you get 6 to 8 glasses of water. Okay, 1 liter if you like. Doctor, can I have more? Yes, go ahead. 2 liters if you want. Okay, that is good because it flushes the infection. Now, if the infection has a
Right.
certain number already, Luisa, that is countable, when you say countable, you can count the number of infection, then I think that is a time that you need to give your antimicrobial. Proper
Okay.
antimicrobial.
Doc, what do you say to those viewers or those people that are antibiotics? Say, I think my fear
Hmm.
about antibiotic resistance or drugs being harmful to the body. So, what do you say about that fear?
Mm-mm.
Because I know there's a lot of people that would prefer alternative practices, such as I think you've heard cranberry juice
Yeah,
or
yeah.
probiotics instead na lang, no?
Those are help. Those can help. Those can help for
Okay.
those patients who have very mild urinary tract infection. We are not, Luisa, encouraging them to have mild infection. What we're saying is, if your infection, you detect it and you notice it and you immediately went to the doctor, good. You might the doctor or the physician or the primary doctor might entertain such a supplementation because the condition is not still severe. But if you have severe cases, your urinary tract infection, not all of these cases might work with what you have mentioned. I think you still drink them for the fact that it tends to have a psychological thing na, I think I might get well. But at the onset, if you're talking about preventing infection by taking them beforehand, well, that is better. So we always tell them,
Mm,
Luisa, you take them before you have the infection, right? So prevent by taking
yes.
it, whatever supplement is that, before the infection, not on the occurrence of the infection.
Yeah, exactly, Doc. And I think that's a perfect segue into our next in our next segment over here, where prevention is better than cure. So how do we prevent UTI, Doc?
Okay, of course, drinking lots of water. Okay,
Mm-hmm.
drinking lots of water, adequate bladder practice. When I say adequate bladder practice, if you need to pee, pee. Okay, don't wait for the next morning. Don't next for the next restroom or loo. Where you need to pee. Just pee and pee if you need to pee. Okay. Now the other thing is you have to have your diet plan. Of course, that is very very important. Also, like this slide, genitalia. You can hygiene is also
Excuse
okay,
me.
it's needed. Hygiene is needed because that washes away your bacteria. Okay. Then the other one, nutritious food. Okay, balanced food. Okay, we always talk about nutrition and balanced food, and of course, what I like most is supplementation, like what we have here.
Right.
Okay, and the best supplementation is to take note, Luisa, of the ingredients. What are the ingredients that is needed in order to protect you from having urinary tract infection? So, when you talk about supplementation, it is where you have in organic acai all the ingredients that will protect you and prevent you from having this dreaded urinary tract infection. You have your anthocyanin that improves your um, it has a very high antioxidant action. Okay, your anthocyanin, the color of the berry that was squeezed into the bottle has a very strong anthocyanin because the antioxidant reduces the free radicals. Okay, because free radicals also help in propagating bacteria. Okay, it's not only for cancer, but it also propagate for bacteria. You have your phytosterol, your flavonoids. Okay, your flavonoids are very very good to improve linings. I like flavonoids because you can find them in a lot of other supplements because they help in protection of the membranes, the linings, and the organ system. It keeps your immune system also intact. Okay, then you have your phytosteroids and your phytochemicals. Okay, all together, they with the flavonoids they improve the what circulation and the blood flow. This is what we need, right? We need blood flow and circulation in order our defense system can pass through all these enemies or bacteria that we are talking about. Or even before the bacteria come in, or even without the setting in of urinary tract infection. At least it sets the tone for our immune system to be strong, to be healthy, just in case, we're not saying we want to have infection, just in case that happens, we are adept to that. Okay, so what else? So those are things, and besides the vitamins that we have with your organic acai, you have theobromide that's very very good for the brain. You know, if you don't like to if you cannot sleep, you just drink that. It has a lot of theobromide. You can have a good nap, right? And those are the things. And you have omega
Yeah.
369, right? Okay. Did I miss anything? I'm just, I think that's about
I think I think we all know vitamins and minerals are very good for us, Doc. No,
Yeah.
and then so I just actually wanted to kind of maybe summarize what you just said, and maybe clarify a few points. So my understanding, Doc, no, is that a healthy diet and proper supplements are very important for us in order to prevent UTI. Kasi, first of all, it boosts the immune system, no?
Yeah.
Proper function, and then things like free radicals, which antioxidants attack against.
Right.
Like love, parang assistant siya sa bacteria, no?
Yes.
So, so antioxidants and nutrient-rich foods tend to attack yung assistance sa bacteria. And then they also increase the blood flow para there isn't really, para the blood is always renewed and cleansed, no? Which I think is, which I think is a problem sa UTI, especially when it reaches the kidneys, which is the one that turns our blood. So if I'm thinking of an imagery, doc, parang siyang washing machine, no? Yung kidneys natin, it's a washing machine for a lot of our blood. And then if the water is dirty and if it's not properly circulating, then our clothes are still going to be dirty and there's going to be that infection. So yung antioxidants and flavonoids, which help to increase the flow of blood and that circulation, will have clean clothes, clean kidneys.
Right.
Yeah, I hope I'm understanding what you're saying
Nice,
here,
huh?
Doc.
I like your description of the washing machine. That's true. That's true because
Mhm.
the only thing that will keep us afloat or your immune system above what we want to is when we have the ingredients. If you need to have if you want supplementation, meaning at the end, at the beginning, you never thought of taking a lot of your antimicrobials. You just want supplementation. So our organic acai has all the ingredients to build up what you need just in case that an attack of a urinary tract infections comes in. You probably
Mhm.
won't experience it because of the stability of your immune system that is projected by the intake of our acai berry, and can well be good as taking in antimicrobials in the beginning.
Yes, okay. And then Doc, one more question about yung proper diet is, so we already know what the proper diet looks like, which is a diet full of antioxidants, vitamins, and nutrients. So what does an improper diet look like? A diet that will increase our chances of getting UTI.
All Luisa, all the masarap.
Oh no.
all the fatty foods, all the trans fat there,
Mhm.
whatever, all the sweet food, right? They always say, why do you have to label everything and put a list and tell us not to eat? Do you want us to live? Of course, we want you to live. We want you to live a healthy life and a great lifestyle. But the thing is, all that is good, all that is oily, all that is fatty, all that is salty is bad, right? Do you
Yes,
agree?
Doc. Yes.
Uh,
But it tastes so
that's
good.
it.
So every once in a while na lang, no?
Yeah, once in a while, siguro.
Yes. So, Doc, before we wrap things up, I just wanted to go to our questions over here. We have a lot
Hmm?
of comments and questions here. So, first of all, we have here from Celia G. Tura, who says, Organic acai is pure. It is good for everyone. My husband really loves acai coffee for healthy lifestyle and longer living. Now, Doc, I have a question here. So, I know coffee is a diuretic. How does that affect UTI? Now, diuretics, for
Okay.
people who don't know, help you. Doc, can you explain what a diuretic is?
Okay, diuretic is a substance that lets you urinate. Okay, it lets you
Mm-hmm.
urinate. It stimulates the collecting tubules, which is present in the kidneys, to help you urinate more. Okay, either you have
Yes.
drugs, food for that, or you have food substance. Okay, now coffee or caffeine is one that can be a diuretic. One, because it's a good it has nutrients. The caffeine content and the nutrients that you find in coffee sometimes become food for bacteria. Okay,
Mm-hmm.
yeah, they favor that. So that is why when you have mild infection, doctors usually ask you, can you lower down or decrease the number of cups of coffee that you're drinking? Okay, so that
Right.
you won't have an attack of the bacteria into the coffee.
Right. Well, for those of you who have UTI or suspect you have UTI, take it easy na lang sa acai coffee nyo and then ibang coffee. But then, if you don't have UTI and you don't suspect you have UTI, we highly recommend um, just like 1 cup or two a day, which I think is a normal
Yeah,
amount,
one
Doc,
cup
no?
is okay. Then drink a lot of water.
Yes. Okay,
Yeah.
so again, we have here from Celia G. Tura, who's asked, can UTI be hereditary? I have UTI, then some of my children have it too. But some of my children don't like salty foods and soft drinks. It's just me and my youngest daughter. So can you explain, Doc,
No.
bakit yung anak niya and then she has UTI, but then ang iba wala?
you might not, it's not hereditary in its course. It cannot be passed through children of first generation, second generation, and third. It's not like that. It's behavioral. All right. So when you say
Mm.
behavioral, you have to teach your bladder to behave, when to pee and when not to pee. When you drink a certain amount of water and you need to pee, you pee. Okay. Sometimes you will say, I haven't drank that much. Why am I peeing? Probably have a condition that we need to look into, right? And proper bladder behavior is most important to prevent infection, Luisa, both for the young age, both for the pediatric age, and even for adults, even the elderly. Okay. When I say proper bladder behavior is, if you need to void, if you need to pee, go to the bathroom. Some are lazy when they're sleeping. They don't want to go wake up, right?
Yes. So, what is your solution to that, Doc? Should we just drink more water or lose a bit of sleep?
No, if you're like,
And just drink
if
less
you
water.
okay, if you it tends to, if you are to sleep and you do not like to wake
Mm-hmm.
up because you're lazy, then do not drink lots of water before you go to sleep. So though you won't be avoiding that much.
Okay. Okay, Doc. So we have another question here from Joe Seva who says, is coconut juice really helps eradicate UTI and how? And what oil is good and healthy for us? Kasi I think, they heard, Doc, na yung mantika, yung
PCO.
oil is very dangerous for us.
Okay. Uh, okay. Coconut or buko juice for me is just water, same as water with taste. With taste, may
Ah.
lasa. Those who do not like to drink water because it's tasteless, they just want soda, whatever. Coconut water is water with taste. So the same
Mm-hmm.
thing. The action of water, which is what we're taking, which is a bland taste, is the same as coconut water. Okay. When you talk about oil. Okay, I'm not into cooking oil. I think what is nice is you fancy not the animal oil. You get more of the vegetable oil when for cooking. If he's
Uh-huh.
talking about, she's asking about cooking oil. Yeah, I think the vegetables oils and like you're saying the omega 369 type of oil.
Yes. And then, Doc, we have another question here from Elmo Nolasco. Actually, Elmo asked a series of questions, so I'm going to start with one of them here. Who asks, I always have UTI after we have contact with my partner. So, what is the reason behind it?
Okay, so you have to be hygienic. that that might be a problem. Luisa,
Okay.
my patient will ask me, Doc, can I wash before we do contact? Yes. Can I wash after I contact? After we contact? Yes. If
So,
you're
before and
scared of it,
after.
yes, you can do that. Oh, hindi ka mapapasma. They will say, mapapasma ba? No, that's a myth.
Okay. Okay, Doc. So, what about, I think I've heard, for example, na people are saying that if you urinate after contact, that's going to prevent UTI. Is that true, or is that the replacement for actual cleansing?
No, you urinate to prevent you from. Okay, now you have to see, if you have to see that, okay, urinating before contact is just to prevent the psychological for the spillage of the urine into the organ, no, the female
Okay.
or the female organ, or okay. Now you might have that presumption just in case that your urine, Luisa, is contaminated. When I say contaminated, the urine has bacteria infestation. So
Mm.
you might probably have a chance, even before the contact or during the contact, if you spill urine, you might have infection spilling down the female tract, whatever. So it is best if you say that can I urinate before contact? Yes, that's the best practice. Can
Okay.
urine that is infected during if spill it during contact can I have infection? There is a probability if it's infected.
So what you're saying, Doc, is before and after contact, urinate and cleanse for our
Yes.
viewers at home. Okay.
Yes. Yes.
Okay, and so these are some safe practices. So,
Safety
Doc, we have
practices.
another question. This is going to be our last because we're running out of time, and ang daming questions, Doc. I think we need you to come back for another week. I think a lot
Sure,
of people seem to
sure.
have questions about yung
Right.
urinary tract nila.
Sure,
Yes.
sure. Surely. We have part
Actually,
two of
I don't
this.
even know where to start if we're here. Yes. Okay, so Doc, there's one question from Erica Castillo Juan who says, "Does the color of my urine indicate UTI? I have a situation before. I thought my daughter have UTI because of yellow urine, but her pedia says her urine analysis is normal. Hence, she is only dehydrated."
Okay. I think that is a very good observation, Luisa, of the father to the child. Okay. But at the end of the day, you cannot compare your urine to your children's urine. Okay. Yes, the color has something to is a very good indicator for infection, the possibility, or the intake of food endogenously that can give color to your urine. High infection can give darker color of the urine and the pH can increase. Okay, these are possibility. Okay, but this has to be for experienced individual to look into because you can have T color because you have liver problems, you can have infection, typhoid fever. Okay, those are things that I probably can say to our caller or the one that messaged that yes, he's very observant. Since he found out that these are quite unusual, then he has to proceed and have himself or his child checked.
Right. I think Erica managed to get her daughter checked by the pedia, and she
Okay,
said it was
very
completely
good.
normal. So I think, yeah, exactly as you were saying, Doc, that they are good starts for us to bring us to the doctor, and then the doctor can be the expert to check. So,
Exactly.
yes. So, Doc, I think that brings us to the end of our episode here. Thank
That's
you so
it.
much for joining us. I know we'll have more.
I'm
We'll have
enjoying
more.
our talk. Oh,
Me
yeah, we have
too.
more. We'll have part two.
Yes. So, Doc, what are your takeaways for us about UTI? A big summary.
Okay. Do not underestimate UTI. Okay, that's number one,
Mhm.
right, Louisa? Do not
Yes.
underestimate it. Do not think that this is something that you can slip over with. Right? When you say slip over, tomorrow it's gonna be gone and that's it. Okay. Now, if there are things that seems to be unusual, there are
Mhm.
patterns when you are urinating seems to be different. There are symptoms coming in different. Then seek a specialist for consultation. So you can be properly treated. Now, if there are nothing during the examination, then fine. If there are something that was seen, then treat it earlier before you go into complication. Okay. Now, if you want to prevent UTI, okay, you have to prevent, and of course, you have to drink our organic acai. There is no other way because it has all the ingredients. Don't look for things that you cannot find that really cannot improve things for your immune system, improve the leverage of your cells, the improvements of perfusion of the the blood stream and the blood flow. It's only in our product that we have all of that. That's why it's the best, right?
Well, I mean, you've been a loyal user, Doc, and you've also
Yeah.
been prescribing it to your patients. So I assume it is of quality to you.
Yes, 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 yes.
Yes.
Mhm.
All right, Doc. So thank you so much again for joining us in this week's episode, and thank you for your takeaways. I can't
Yeah.
wait to see you soon. I'm not
Yeah.
too sure when that will be,
Exactly.
uh,
Yeah.
but
Exactly.
we'll keep in touch, Doc. Don't worry about it.
You
Okay.
keep
Thank you.
safe. You
Take
keep
care.
safe. You take care.
Thank you. Thank you, Ingat. Okay, this episode ran a bit long, but as you can see, we have a lot of questions regarding UTI. If you want a part two of this, please let us know. Comment if you want a part two, because we weren't able to run through all of your questions. But moving forward, uh, as Doc was saying, acai berries have a lot of components or parts of them that can help prevent UTIs. So if you know someone, you have that one friend, just bad hygiene practice, joke lang, huh? Maybe you wanna endorse them to Organique Acai through one of our official resellers at Olani PH, or we invite you to become an official reseller at Olani PH. So Olani is the official reselling platform of Organique products, as well as Mestiza skincare and Nua Organics. So you can check them out. Oops, they're gone. You can check them out again at Olani PH. Now, for the winners of our Facebook game, I saw a lot of people commenting. So drum roll, please. Da-da-da. Okay, so this one was from last week's Facebook game, which everyone actually shared their like super lovely stories. So we have here Benjamin Salvador Manuel who shared about his lovely beautiful wife Elizabeth Bailon Manuel. So congrats Benjamin on that. And then we also have here second one. We have here Katlea Olivar Nanao, who wanted to share her organic package to her mother. And I think that's very sweet. So congrats to you, Katlea, and your mom. And then we have here Christy Kring Rosilon, who wanted to share it with her partner, Angelo Marie, and their lovely daughter together. So I hope you all had a wonderful Valentine's weekend, and thank you for sharing your special Valentines and your special people. So that's the winners of last week's, actually, the Valentine's Day game Organique gift pack. So again, congratulations to Benjamin, Katlea, and Christy. Congrats, and I hope your Valentines get to enjoy their belated Valentine's presents. So the winners of the snack line. For everyone who is commenting, I hope you had some really lovely captions. So our winners up here are Fred Castro, who says here, daughter. So the daughter is like, Mom, I love this snack. Really, my daughter. Did you know it's full of vitamins and minerals, and that's why it's very healthy? It's Organique. Thanks, Mom, for giving me the best love ever. Oh, that's so sweet. What a wonderful interaction. And I hope they get to be able, these hypothetical mother and daughters, able to share these snacks. We have here Yana Nero, who says, to eat is a necessity, but to eat intelligently is an art. Now that is very witty. I like that. It really truly is an art form, and we call that culinary arts. So we have here also Honeybell and Brian, who says, an almond trail mix a day keeps your day happy and healthy. I thought you were going to replace apples with that, but I think a happy, healthy day is much better than just a doctor away day. And then we have here Leolyn Pangilina Nuestro Villasan, who says, breakfast is always the best time for something juicy, sweet, and fresh. It's just, it just feels like the right way to open the day. Perfect time for parents and children's bonding while eating together. And I agree with that, Leolyn. Breakfast is the most important meal of the day, but also for bonding, not just for nutrition. Oh, and we have Elno, who actually asked a question a while ago, who said, Elno Nolasco said, my only daughter, I love to give you the best. That's why I always serve you the healthiest way to start the day right and healthy with Organique Almond Trail Mix. That is actually so sweet. That is wonderful. I hope your daughter gets to enjoy the trail mix. So for our winners, congrats to Fred Castro, and I hope it's pronounced right, Yana or Waina Nero, Honeybell and Brian, Leolyn Pangilinan Nuestro Villasan, and Elno Nolasco. So congrats to all our winners. I know Wellness Wednesday ran long this week, but I hope you guys enjoyed and managed to stick around, pay attention. And I can't wait to see you soon in our following weeks.
Wellness Wednesdays with Organique. We care because you matter.